I am Fabio Nicoli. Now I work in Newcastle in the UK. I'm a plastic surgeon. But it's important to remember people that participated in the study. My colleague Alberto Balzani, a dermatology and also a plastic surgeon. Alberto used Marangoni's laser at the very beginning. So Francesca's father and Alberto helped me during my training of plastic surgery. Alberto is also a plastic surgeon, and Alberto told me the importance of the laser therapy. Another important professor is Professor Yixing Zhang, head in Shanghai. And so, once we delivered this new technique, or when we presented this technique, Professor Zhang was very much impressed, and he used this technique immediately after being shown, after it was being shown to him for Asian patients. So, let's get started now talking about scars. So, where do you think that's an important problem, hitting almost 100 million patients every year? And I mean, that's a stigma, that's a social stigma. Sometimes patients, are just labeled for this, stigmatized. And so that's a social problem for these patients. And now you see some footballers, Ribéry and Tevez. You recognize Tevez. It might be very well treated with our laser, and also good results, Tevez, this footballer. So scars are a big problem, an important problem also from the psychological and social viewpoint. In addition to this, scars can also cause itching and pain, and also burn scars. They contract a lot. So you know what I mean. So we start from these assumptions. So it's very important to treat these scars. And also, it's quite important in a way, it's key to recognize the types of scars. We know that we have a lot of scars. And also, the pathology differs a lot. Also, from the histological viewpoint, these scars are different. Hypertrophic scars, they have a higher collagen deposit, and fibrin and elastin. Keloids even more. So keloids, so with more collagen deposit, and keloids give rise to or form new blood vessels with the new proliferation of fibroblasts. So that's important from the histological viewpoint, but also it's important to recognize these from the clinical viewpoint. Keloids and hypertrophic scars. Now we have a difference between keloids and hypertrophic scars. Hypertrophic scars, they reabsorb in 1 or 2 years. In 20% of cases are stable over the time and also recurrent. Keloids instead, they show up again, and they never go under a real regression. So, and they just worsen over the time. So it's important to make a sharp distinction between these two from the clinical and the histological viewpoint. And also we have a lot of treatments available from the surgical viewpoint and from the viewpoint of laser methods. Many of you, no doubt, use one of these two treatments, isn't it? So we start from the easiest ones, the silicone sheet and silicone whatever, or creams, making the chemist get money, and not the patients, making them feel better. And also cortisone treatment, which is the mostly used, and we try to reuse it, the cortisone treatment, even though we made some updates about the cortisone treatment, and also other kinds of treatment, radiotherapy, or chemotherapy, so 5-fluorouracil, bleomycin difficult to give to the patients, and not all patients can be just treated in a clinical surgery. So surgery as well has a lot of recurrences from the viewpoint of keloids. So that's our last resort for this kind of patients, and also dermabrasion, radiotherapy with some disadvantages and drawbacks. So finally we thought of something new. Which new technique might we use? And so we thought of this laser. We use it for the endolift, and we use fibers. So we use these fibers today, thanks to the novel laser technology, very innovative technology. Now we have this new type of laser available, and we use also the optical fiber, 0.3 millimeters, 300 microns. And that's me in the film. The video clip, you see the keloids. Chest of the thorax, a chest keloid. And so we just get in with the fiber, and the fiber gets through the tissue, and you see the fiber. Can you see the fiber? So the tissue is red because it's inflamed and turns out to be white. So there's a sort of coagulation in the keloid area. And so fiber has two main principles. The first principle is fiber can reduce the volumetric tissue of the keloid, melting the tissue and reducing the volume. And in addition to this, it coagulates blood vessels of the keloid. So the keloid, you see the way it behaves, so shrinks. And then we have the coagulation of the new keloid blood vessels. We have two properties as the laser fiber. So it acts at the very level of the cervix. We know the keloid has an inflammatory activity longer, proliferative activity longer in a way, and that's different from the usual scars, for which the inflammation is quite short over time. Proliferation takes 1 month, and remodeling takes 6 months. So we have an effect on the 3 phases of the scarring cycle, thus reducing the keloid tissue and the inflammation, and also having more stability from the histological viewpoint, and more stability of collagen. So we have to study this much better from the histological viewpoint, because we have the amine deformation of new collagen fibers, even different from the fibers that are being previously formed by the keloid. So the achieved results so far by this clinical trial study have been very important. We assess the scar pre and post surgery, pre and post op, from the viewpoint of pigmentation, pliability, vascularity, and also from the viewpoint of the volume. And also we studied patients from the psychological viewpoint, the duration of pain, and whatever. And also we studied edema or necrosis of hyperpigmentation. So results achieved so far are quite well promising. So there's a preview of these results. New results, very, very, very satisfactory results. I'm showing you a few cases. So these patients, as you can see, there's a 4 to 6 years old man with a burn scar with 3 laser sessions on the average, 1, 2, or 3 sessions at the interval of 1 or 2 months. And also the maximum power, 3-4 watts, up to a maximum wattage of 6 watts. That's important in a way, not to necrotize the tissue, never do this, but rather to close out the blood vessels and to reduce the tissue. So the main point of the keloid in Asian patients above all, the keloid is not to be pigmented and being stable, so there was no keloid recurrence after one year follow-up available now. Other scars that are being treated so far, so you see hypertrophic scar of the hand, cervix, and also of the foot are the scars that have been assessed with this laser, LASEmaR, which is a Swedish machine, by ultrasound. So we have seen that vascularity is very small. Fiber made the keloid mature, and the volume went down enormously. So as you can see in the second image of the laser, so vascularity, so you see vascularity reduced a lot in the keloid. Other cases we treated so far, so you can see very well here the laser fiber reduced the keloid, and also from the viewpoint of ultrasound, the thickness of the keloid went down enormously. We got positive cases, and also another important point to mention for, infected and inflamed keloids. So this method also works for infected and not just inflamed keloids. You know quite well that very time keloid is inflamed and infected as well. There is an infection ongoing. So during the case, we thought, what else can we do? So, but the treatment, solved the infection of the scars. So no more infection at the scar level. So brilliant results achieved so far. And then we published these brilliant results in this publication, in this paper. And we're just publishing additional results with more papers to come. So that's a picture of this paper, a picture from the paper we published. And you see the keloid was inflamed and also possibly infected, but with this treatment, in the acute phase, we had some reduction of the inflammation and infection, and a regression of the keloid. So a quite positive result. We're very proud of this. And also this has been studied using the laser method, LASEmaR, just to study vascularity that went down enormously. So in conclusion and in principle, we can say that hypertrophic and keloid scars reduce in volume, and we had brilliant results, subjective results, and objective results. So subjective from the patient viewpoint, and objective results because we studied these results with many devices and machines, as I've been showing you so far. So scars and keloids reduced enormously in volume, in size, and we get no complications, recurrences, or whatever, or pigmentation of the keloid. In most cases, just to speak plain, the infection, itching and pain have been reduced, and so the patient's quality of life improved a lot. What we're studying now, so how the fiber works from the histological viewpoint, and how to use the fiber for other scars, burn scars, or other kinds of infections, just to have a wider use of application of the laser fibers. And in our hands, up to date, we have seen that's a totally effective technique, and the backbone very safe from the patient's viewpoint. Thank you for listening. That's it for me.